Thank you. Now I will hand over to Khadilkar sir for lateral position draping of the upper limb.
Yeah, thank you, Shantaru. So here we now come for the draping of the elbow and posterior arm in a lateral position. So this is the most common position that we use while operating on the intra-articular fractures of the distal end of humerus, shaft of humerus when you are doing a posterior exposure for plating, or olecranon fractures and upper third ulna fractures, radial head excision. So all these surgeries, you require a patient in the lateral position with the affected side up and the arm dangling on a pillow or a attachment to the table. So again, here, as you can see, this is a live volunteer, not a mannequin, because it was not possible to turn the mannequin on one side. So we have used a live volunteer. He is one of our lecturers who agreed to do it for us. So the anesthetized patient is on the lateral side with the limb to be operated held up. These are the various photographs of draping. Now we'll come to the video. So here the patient is lying. So again, the first thing that you do is isolate the part with a plastic sheet. The assistant is holding the scrubbed and prepared hand. So this is the second plastic sheet which we have been constantly telling you about, through which the hand is threaded and it goes right up to the edge of the tourniquet. Now comes the first cloth sheet. It's a big sheet which covers the armrest and it goes right up to the tourniquet, over the head and the chest. The second sheet is unfolded and is allowed to drop on the other side, and then the two sheets are secured, one in the axilla and one just above the shoulder or above the arm, just below the tourniquet, with two towel clips. Again, take precaution that you don't puncture the tourniquet, otherwise you will have a tough time while operating. One more medium-sized sheet goes over the head end. A second one comes from below. So as you have seen in all the surgeries, everywhere we are using two layers of drape. It is never a single layer of drape. Coming from two different directions, we are using two layers of drape. Now a big sheet goes on the lower part of the table and covers the lower extremities and the lower half of the body. The last one, it's a small or a medium sheet which takes the forearm and the hand, covered it completely, and is secured either with a roller bandage or a clean drape, depending on the availability. So here, as you can see now, the area that is exposed is the upper third of forearm posteriorly, the elbow posteriorly, and the arm posteriorly. So as I said, this is the position which is required when you are operating on the humerus from the posterior distal end of humerus intra-articular fractures. So there you go. So the hand is now resting on the armrest, completely draped and isolated. There goes the anesthesia screen, which isolates the head end and the anesthesia trolley from your operating field. So that is the way how you ideally drape for the arm and forearm, upper third forearm and elbow for a posterior approach.